This is Dr. Dan, board certified pediatrician, and welcome to Is That Normal? Today's topic, what do I do if my kid has a fever? So if your child has fever, remember, stay calm. Fever is your body's response, but fevers stink. And if your kid has a fever, they're not going to eat well, they're not going to drink, they probably won't sleep. So it's not so much an urgency to treat it, but if you do, I can give you something that'll really help, because a lot of times people will give medication for the fever and it just won't work. And then they're like, what do I do now? I don't have anything else. The two tools we have in our toolbox are acetaminophen, which is Tylenol, and ibuprofen, which is a series of different ones, like Motrin and Advil are both, they're like Coke and Pepsi. They're both forms of ibuprofen. And an important thing is they don't interact, meaning that you can use them together. So usually what happens is when you give Tylenol, there's a specific dose to give. It's something where pediatricians know you can read it off the back of the bottle, but sometimes that's not quite enough. So you can always call your pediatrician to get a dose. In metric, it's 15 milligrams per kilogram of weight. We're not a metric place. But Tylenol you can give every 4 hours at that dose, as long as it's not for days and days on end. You probably want to do it like about 4 or 5 times a day, but it can be given every 4 hours. Ibuprofen, that's 10 milligrams per kilogram per weight. And as I said, that's either Motrin or Advil. That can be given every 6 hours. And some people find Motrin works more quickly and brings the fever down better. To me, it all depends on your kid. But here's the thing. If you gave Tylenol because your child has 104 fever, and an hour later, they're still at 103.5, you can't give Tylenol at that point. You can do regular things like a warm bath, not cold. You don't want to freeze the kid. You can put cool compresses on, but you also could give ibuprofen at that point. You just have to then remember it's 4 hours from the Tylenol to the next Tylenol, and 6 hours from ibuprofen to the next ibuprofen. But sometimes the two of them in concert will bring the fever down enough to give everybody that rest that they need and allow the child to drink and get what they need to do to start to feel better that night. It's really important to remember, though, fever is merely a symptom. It's your body's response. It's not a disease. So if there's anything else, your child is feeling not acting normal, vomiting too much, altered